My name is Walter. I was a respiratory therapist for 20 years at first it was Richland Memorial, then it was Palmetto, Richland, and now it's Prisma Richland here in Columbia, South Carolina.
Awesome.
And I did pretty much all night shifts other than when I very first started. So I'm a night shift respiratory therapist. And we would cruise the hospital and have lots of things happening all the time. So that's what life is like as a basic to be a respiratory therapist.
Cool. What initially inspired you to become a respiratory therapist?
Well, it's an interesting story. I'll try to keep it a little bit short.
Okay.
I previously had a job that was a physical job, which was okay. It didn't pay so much. But then I had an injury to my shoulder, and it didn't keep me from working, but it made me realize I wanted to do something different. And I ended up having a very basic, simple hernia repair surgery, which is very common and easy. But I spent a couple of nights in the hospital, and I remember just thinking how really nice and wonderful, the nurses and the aides were, and how, wow, this would be a great field to be in, something, in nursing where you can really help people, So maybe I was under a little bit of medication also, but it really sort of inspired me that there was possibility in healthcare. And when I researched it, there was a very long line, a waiting list to get into the nursing program, but then the respiratory program was just like 2 years. And at that time, nursing was like a 4-year wait. So I put my name on the respiratory list because I had a history of appreciating breathing. I did yoga when I was young a lot, including breathing exercises, and I thought, oh, I would like to help with breathing. So that's what really prompted me to explore the situation.
What exactly is respiratory therapy?
Well, respiratory therapy is a part of the allied health field. So you're sort of a little bit similar to being a nurse, only you're in allied health. And that means you're helping people with their breathing difficulties. Sometimes the people are alert and functioning and, mobile, and sometimes they're laying in an ICU, comatose and on a ventilator. So it's a whole range of type of things that you do. But the bottom line is you're keeping people, either keeping them simply alive, or you're making their life better by helping them to manage the problems that they're having with their breathing.
Awesome. So a lot to do with the lungs?
It has to do with the breathing and the lungs, and it's, part of the job is education of the patients. In a hospital setting, it's more of dealing with ventilators and ICU type situations, at least in a large major hospital. If you are working in a doctor's office or outpatient, or there are other fields that would be dealing more with, really mobile patients that you can really help and train to do something. But there is also that in the hospital, training people how to use their medicines and how to do things like that to keep them in a better condition to function in the world.
Could you describe a typical day in your role as a respiratory therapist?
A typical day would be normally we would have 12-hour shifts, keep that in mind, so you want to be well rested before you go to work. And my day would be resting in the afternoon before my first shift at night, when I worked at night. And so that's part of it, is to arrive to work on time. In the health field, you really need to be arriving on time. It doesn't work to be coming in late very often. You have to be pretty dependable. That's a big thing of working in a hospital, is dependability. So the day would start, you go in and you get your assignment. Somebody would have an assignment of your patients and what you're supposed to do. And then you organize that in some way that you can try to figure out the best way to do it, what areas you're going to do first and what's going to come later. And then you just get out and start working. One of the things in respiratory, at least in a hospital setting, that might be a little different from, for example, a nurse or CV tech is oftentimes you're on your own, so to speak. There's nobody looking over your shoulder, and that's really good. I like that. The downside of that is there's nobody to look and see, oh my gosh, your assignment, you had some new patients came in and you're all of a sudden you're really overwhelmed. Things were happening that weren't sort of planned into the night. And so you have to recognize that sometimes it can be difficult to to people understand that you don't have the time to do what you might want to do because you just got some more patients came in, or your assignment at the beginning was too much because you're short-staffed or something like that. So that can be very stressful. But part of the day, time management is a big part of working in a hospital and knowing how to prioritize and what's going on. And that's, like I say, it's a little different if you're a nurse and you know that your limit is 2 patients in the ICU or 5 patients on the floor. You're only going to have 5 patients. You know, in respiratory, you might start out with, 6 ventilators and end up with 8 ventilators or something like that. And in which case, you have new patients coming in. They have to be admitted. They have lots of things to do. It's a little more unpredictable. A little more unpredictable than some jobs. If you're working directly with a doctor in the cath lab, you're working with the doctor. You can only do what he knows that you're busy. He can't ask you to work on 2 patients at the same moment. And there's somebody watching and they can sort of see what's happening, but in a hospital, that's not quite always the way it is. But there is always backup if you need it. If you have a supervisor that you can call on if you're in a larger hospital. So it's not like you're on your own. You're part of a team, and that's a big part of working in respiratory is realizing you are part of a team. If somebody else needs help, you help them. If you're about to go take a long, well-deserved lunch break, you might want to check on your partners first to see if they're drowning before you go sit down. So that's part of it, is to be part of a team.
What advice would you give someone that's totally brand new considering this career path?
Well, I would say to realize it's very rewarding. It is also can be very stressful. You have to be able to deal with stress. You have to be able to deal with people, because when you're dealing with patients, you're often dealing, and families, you're often seeing people in some of the worst days of their life. So you have to understand that you're the one that can be there, at least for a little bit, sort of helping them out, in a sense, maybe being their friend for just a few minutes, or their assistant, and doing what you can to help them. So you have to understand that it's not an easy job from that point of view, at least in most, some days is easy, some days is not, but you have to be prepared that it's not a walk in the park. But, and also I would say this, at least my experience going back to school, I was 40 when I went back to school. I practiced 20 years after that. But school was hard, and I was a good student, and I did very well, but I'm telling you, it takes both the basic intellectual capacity to do it, but it also takes a lot of work, and it takes a lot of maybe sometimes things you think aren't so important that you have to just do. So the schooling itself is difficult, and don't expect to walk through it. You have to really commit yourself to it. And so, but at the end, having retired, and I am retired for a while, I can look back and be very happy that I did a lot of good for a lot of people, and I'm happy that I was able to have been a respiratory therapist. So that is, it can be very rewarding in other healthcare fields too. You're doing something that's important, and there's a sense of satisfaction with that as you get older in life. You have to appreciate people to not, you can always do a job and just be mad all the time, but if you want to try to appreciate your job, you have to learn how to appreciate people, really, and how to work with people and deal with people a little bit. That's a big part of it, really. Okay. And families, I'll point that out. Sometimes it's the families that are harder to deal with than the patients.
Things that you would do to or with the patient to actually help them?
Well, I would say, of course, my background is working in a high-level trauma center, heart center, Palmetto Richland, Prisma Richland. And so it might be different in a different place, but there are almost maybe 2 different types of assignments that I would get. One would be working in the ICU critical care setting, and that would be a lot of ventilator work and BiPAPs and things that are technologically involved. And of course that requires a lot of thinking also, and a lot of organizational. And then a different level, a different type of assignment is when you're out working on the floor therapies, when you're giving like inhalers and what we might call lung expansion help and things like that, suctioning, trach cares, that type of thing. Those are different types of patients that it's a little more calm typically, and maybe a little more patient interaction with a lot of patients that are alert and you can talk to and things. So there's sort of two types of things. One would be the dealing with alert functioning patients, so you're helping them to do their breathing medicines or their treatments, and another is working in patients that are maybe just laying in bed and you're just managing their ventilator to keep them going and hopefully get them off the ventilators at some point. And then and I did not work in, for example, home health care and pulmonary function labs, but those are jobs that are really sort of different, and they're also dealing with people and they have their role, but that's a little different from normal hospital settings.
Well, ladies and gentlemen, we heard it here today from my friend here, Walter. We actually met by playing pickleball with one another, and I discovered recently that he was a respiratory therapist for quite some time. So I was very intrigued, and we got the best advice from him today. So thank you so much, sir. I really appreciate your time.
Well, and I want to say thank you, Move, letting me talk a little bit. And
Absolutely.
also, I'm very happy to hear that you're going into healthcare. I think you have a very good way of being with people, and I think you have a good heart, and that's a big part of a start. So thank you for your future work.
Absolutely. Appreciate that.
And anyone who's listening, explore what you want to do. Make sure you sort of know what you're getting into before you commit all the way, but once you really get into it, you can have a good life being whatever you are in healthcare.
Awesome. All right, guys, if you liked the video, leave a like, leave a comment if you got any questions for me or Walter here. I'll relay them to him and respond to your comments accordingly. You guys have a wonderful rest of your life, and we'll see you soon.
Thank you.
Awesome. That was fantastic. Couldn't have been better.
Oh, well, thank you. I felt like I said